Iridology proudly presents to you a short presentation on iridology. What is iridology? Iridology is a study of the patterns and colors on the iris of the eye to determine information about an individual's overall health. Iris charts are used to make these observations, as the iris is divided into multiple zones, each of which represents a different aspect body system or organ of the human body. Iridology is a non-invasive method of viewing the iris to determine where health issues may exist. While iridology cannot diagnose diseases, it helps to determine which organs and systems in the body are under stress and at risk of developing specific conditions. An iridologist will examine a patient's eye and compare the findings to a chart identifying potential health conditions that have caused changes in the iris. They will also collect measurements over time to track changes that indicate if an illness is progressing or improving. What is iridology used for? Iridology gives the health practitioner a tool to analyze the overall constitution or resiliency of a client, which is invaluable when selecting appropriate natural protocols. It also provides an insight into our inherent challenge areas or areas of less vitality, which we each have inherited based on genetics. An iridology reading will help to identify potential causes of problems before symptoms or pathology develop in the body. Iridology may reveal that organs or systems are under or ever functioning or predisposed to disease. By predicting areas of lowered resilience, iridology can be used as a preventive tool. Clients can use the information from iridology readings to improve their health and make therapeutic lifestyle changes, avoiding problems before they occur. Iridology does not diagnose disease. Rather, it is used to analyze tissue conditions as reflected in the eye. It is used in conjunction with medical history, physical examination and other corroborating clinical evidence to decide appropriate treatments or therapies. Iridology should then be used by practitioners with recognized medical or complementary health care qualifications. Although anyone can technically learn iridology, applying it without any training in medical sciences may lead to misinterpretation of the iris signs and misdiagnosis. What does iridology reveal? Assessing overall health. Our irises contain thousands of nerves. These nerves are connected to systems in the body via the brain. In turn, the health of the body is recorded by these nerve impulses through the brain and onto the iris. Blood vessels and muscle fibers are also present in our irises. The information recorded in these vessels and muscle fibers can provide an iridologist with a wealth of information. By analyzing the fibers in the iris, an iridologist can offer their client an overall health assessment. In conjunction with the client's wellness history, using iridology can help health professionals to recommend lifestyle changes. Wellness. The eyes can also be monitored for positive or negative changes. This can help the iridologist to alter their previous recommendations and suggest new ways for the client to improve their wellness. Identifying potential imbalances. In the practice of iridology, health tendencies and potential imbalances can be discovered through spots, discoloration, or changes in the fibers of the iris. The affected iris is also important to the iridologist. For example, problem areas in the left eye signal potential imbalances in the organs on the left side of the body, whereas the right iris corresponds with organs on the right side of the body. Determining health tendencies. Our genes affect our irises and the rest of our bodies. By looking at a person's iris, the iridologist can determine what lifestyle choices the client may want to focus on. Even if the client isn't currently experiencing any problems, iridology can help the client to embrace positive lifestyle habits based on their iris's genetic markers. Analyzing organ function. It's difficult to know if our organs are functioning properly. Iridology can provide insight into which organs are over or underactive. By gaining this information, an iridologist can then make suggestions based on the affected organ system and any other imbalances that may be contributing to the organ's current state. Nutrition. Our genetics only tell a small part of our story. Our environment, diet, and lifestyles can play an even larger role in our health. By examining the iris, an iridologist can help to assess a person's potential nutritional needs or imbalances. In short, iridology assessments can give the client a tool that can help them to support and become more aware of potential health concerns. The iridologist can then work with their client to help improve these areas of health and wellness. How does an iridology consultation take place? The consultation begins with an anamnesis of the individual. A picture of each iris will be taken and projected on a computer screen. The iridologist then proceeds to examine the individual irises with the use of a magnifying lens and/or microscope to detect tissue change, stromal irregularities, and pigment patterns. The irises will be examined in approximately 90 zones, each corresponding to a different part of the human body. A verification of the individual's tongue and fingernails will also be evaluated. Once this procedure is complete, a bioresonance quantum non-invasive machine will be used on the individual to reveal the presence of any potential bacteria, virus, or parasite in the organism. Thank you very much for your attention, and we are ready to enter into an active dialogue with you. Or visit our website www.iritube.com.